Picture this. Someone you know is going through a severe mental health crisis. Where's the very first place that crisis usually becomes most visible to the authorities? You'd think maybe a hospital, right? Or a doctor's office, maybe a community clinic.
Well, the stark reality is actually much heavier. For far too many people, the true front door to the mental health system is a county jail. Yeah, this is often the very first place where a severe crisis becomes visible to the folks in charge.
Welcome to The Explainer. Today we are unpacking a seriously complex reality: mental health care inside New Hampshire jails. We're going to dive into how this system actually operates, what the law demands, and the literal monumental challenges of treating mental illness behind bars.
So here's our roadmap for today. First, we'll look at the jail mental health crisis itself. Second, New Hampshire's legal mandate. Third, what the treatment process actually looks like on the inside. Fourth, the systemic challenges behind bars. And finally, re-entry and community safety.
All right, let's jump right into Section 1, the jail mental health crisis.
You see folks walking into a jail facility, they're rarely dealing with just one simple issue. It's like a giant puzzle. Many arrive with a whole complex web of pre-existing conditions. We're talking deep-rooted trauma, severe depression, anxiety, or psychosis. And on top of that, there's a massive overlap with co-occurring substance use disorders. But it doesn't even stop there. Let's say someone was actually coping pretty well out in the community. They can suddenly develop acute psychiatric symptoms the second they walk through those doors. Why? Because the sheer, raw stress of an arrest, being suddenly separated from your family, and the harsh reality of confinement. It is incredibly triggering. Add in the immediate physical toll of intoxication or substance withdrawal, and you've got a highly volatile medical situation from the literal moment of intake.
Okay, moving on to Section 2. Let's talk about New Hampshire's legal mandate.
Now, here is an absolutely crucial point to understand. Mental health treatment in a New Hampshire jail, it's not optional. It's not just some perk. It is a strict, undeniable legal requirement. The state's system is legally mandated to provide humane care and treatment in the least restrictive setting possible. And honestly, this matters to every single one of us. It's not just about human rights, although that's huge. It's about overall community safety and how we manage public resources. The pragmatic goal here is simple: stop self-harm, prevent suicide and violence, and avoid unnecessary hospital stays. New Hampshire's Department of Corrections has explicitly stated that providing these services to incarcerated individuals who often arrive completely untreated is a fundamental obligation.
So what does this actually look like in practice? Well, the clinical framework requires access to a whole spectrum of services that scale up based on what a person needs. We're talking initial psychiatric evaluations, psychotherapy, and ongoing case management. If things take a turn for the worse, there's immediate crisis intervention and suicide risk assessment. But, sometimes a county jail just literally cannot safely manage someone's psychiatric condition. It's just not possible. So the law has these critical safety valves built right in. It provides legal pathways for hospital transfers to designated receiving facilities. And if an incarcerated person is in an acute crisis and poses a real danger to themselves or others because of their mental illness, state law actually allows for involuntary emergency admission. The whole system is designed with these exact safety valves for when a person's needs just totally exceed what can be done behind bars.
Which brings us to Section 3, inside the treatment process.
Now, every facility does things a little differently, but the clinical journey usually follows 4 main steps. Step 1 is the initial screening, right at booking. This is to catch urgent risks like suicide, severe depression, psychosis, or withdrawal. Step 2 is a full clinical assessment by a professional to evaluate symptoms and immediate safety needs. Step 3, medication continuity. This means verifying and continuing their vital prescriptions. And finally, Step 4 is discharge planning. And believe it or not, this begins almost immediately. The goal is to prep them for eventual re-entry by connecting them to community care before they even walk out the door.
But we have to recognize the massive friction here. Mental health treatment in jail is absolutely nothing like treatment out in the community. Out there, a person might have continuous support, privacy, a quiet routine. But jail-based care? It happens in an incredibly noisy, highly restrictive, and totally unpredictable environment. You've got security protocols and zero privacy, which directly impacts the kind of care clinicians can actually provide. Incarceration, by its very nature, can severely intensify psychiatric symptoms. It makes the job of the clinicians working inside that much harder.
So how can families help bridge this gap? It's a real game changer when families step in.
Naturally, they worry and want to know if their loved one is getting help. While jail policies heavily restrict what the facility can tell the outside world, information can totally flow the other way. Families can be a massive help by sharing accurate medical histories with the jail. We're talking exact diagnoses, current meds, previous hospital stays, or any history of suicide attempts. During that chaotic intake process we just talked about, that accurate info from a family member can literally be the key to helping jail staff make safe, life-saving decisions.
All right, Section 4. Systemic challenges behind bars.
Delivering high-quality care inside a jail is, frankly, incredibly tough. First off, you've got severe facility staffing shortages, which directly leads to really limited ongoing psychiatric coverage. Then, factor in New Hampshire's rural geography. It makes recruiting specialists and coordinating with outside community centers so much harder. Combine all of that with a huge prevalence of co-occurring substance use disorders, and you're looking at a heavily burdened system trying its absolute best to serve a deeply undertreated population.
But perhaps the biggest systemic hurdle of the whole shebang is simply this: jail is short-term by design. Think about it. So many people are booked, held, and then released long before their psychiatric condition can even get fully stabilized by treatment. The clinicians inside literally just do not have the time they need to do their jobs properly before that person is walking back out the door.
And that leads perfectly into our final segment, Section 5, Reentry and Community Safety.
Because those jail stays are so short, discharge planning isn't just some administrative checkbox. It is a vital public safety measure. If a person leaves a county jail without their prescribed psychiatric meds, without any scheduled follow-up appointments, or even just lacking the transportation to get to a clinic, well, the results are tragically predictable. There is an immediate skyrocketing risk of relapse into substance use, severe mental health crises, and ultimately a really high probability of rearrest. The absolute best jail mental health programs are the ones that focus just as heavily on the transition back to the community as they do on the time spent inside.
Fortunately, there are statewide safety nets out there to support this continuity of care. New Hampshire relies heavily on community mental health centers to basically pick up right where the jails leave off, providing emergency screening, case management, and therapy. And for immediate, urgent support out in the world, residents and their families can always reach out to the 988 Suicide and Crisis Lifeline or the state's Rapid Response Access Point. Now, to be clear, these resources do not replace the need for proper jail-based care, but they are absolutely essential, life-saving catch nets for the exact moment someone leaves custody.
So we've seen how correctional health care, state mental health law, and community services all completely collide right at the doors of the county jail. The core principle embedded in New Hampshire's laws is that a person with mental illness deserves humane, clinically appropriate care no matter where they are. So, I'm going to leave you with this final thought, based on everything we've explored today. Incarceration clearly does not erase a person's need for mental health care, but given the stress, the chaotic environment, and the incredibly high stakes upon reentry, doesn't it actually make that care more urgent than ever? Think about it. Thank you so much for joining me on this explainer. Keep questioning the systems around us, and I'll catch you next time.